Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. October is Breast Cancer Awareness Month, and that's the focus of this edition. Coming up, we'll be speaking with the daughter and caregiver for a breast cancer patient about her experiences and about important programs and services to help people in that situation. We begin with Phallisha Curtis, Chief of Women's Health Services for the Illinois Department of Public Health. Thank you so much for being here. I'd like to start by talking about the prevalence of breast cancer. Just how common is it in Illinois and around the country?
Hello, Jim, and thank you for having me here today to speak about breast cancer awareness. 1 in 8 women will be diagnosed with breast cancer in their lifetime, and a projected 310,720 cases of breast cancer will be diagnosed in women across the U.S. in 2024, including 11,205 women in Illinois.
That is certainly a sobering statistic, and it shows the importance of talking about this and helping people understand this issue. Now, recognizing that every case is different, let's talk in some general terms about outcomes for a breast cancer diagnosis. How likely is it that someone will fully recover after breast cancer is detected, and how has that prognosis changed over the last 20 or 30 years?
Breast cancer diagnosis outcomes vary depending on stage of cancer, age, and race of the patient. It's tough to speak in general terms. Upon diagnosis, the patient discusses options with their provider and team of specialists, depending on stage and overall health of the patient. And their medical team can discuss a range of options from chemotherapy to radiology, breast removal, prosthetics, reconstruction. We've really come into a space where there is more specialized or more targeted care. So there's things that happen between you and your doctor that can really just be specific for you. That can the care plan is specific from you. They'll use that world of information out there about how to treat the cancers and how to treat your specific cancer based on whether it's a HER2 receptive cancer or whether it is one that is not based upon any kind of diagnosing and staging. So it's really, in the last 20 years, 20, 30 years, it's really about that specialized care that is really targeted and focused on the individual patient.
We often hear references to someone being diagnosed with a certain stage of cancer. What does that mean?
Staging refers to the size of the tumor and how far it has spread within the breast to nearby tissue and other organs. The earliest stage is the stage 0, or cancers that are localized and that are, in one spot. And it can range from stage 1 to stage 4. There is, medical jargon that further defines these terms. But just to note that where you stage will give guidance to your provider on how to manage your treatment and what specific things they need to do to help improve your outcome. But ideally, finding something at stage 0 or in situ that is not spread is a better outcome for the patient.
And those numbers go stage 0, you mentioned, stage 1, up to
stage 4.
And stage 4 is the highest. Now, one of the keys to successful treatment and recovery is early detection. Some of the guidance, though, for when screening should occur have changed over the years. So what's the best guidance now for when people should begin regular screenings for breast cancer, and how often should they be screened?
So there's a number of organizations out there, from American Cancer Society to the American College of Oncology, or American Association of Oncology Nurses. There's a whole range of organizations out there that have given guidance. And so we generally look to the American Cancer Society recommendations, and they have recommendations at the average risk. And a person is considered of average risk if they don't have a personal history of breast cancer or a strong familiar history of breast cancer, or they don't have any of those genetic risk factors for breast cancer and have not had any chest radiation before the age of 30. And so for those women deemed of average risk, when women aged 40 to 44 have an option to start screening with a mammogram every year. Women 45 to 54 should get mammograms every year. Women aged 55 and older can switch to every other year. Screening should continue as long as the woman is in good health and expected to live at least 10 years or more. Women should understand where they fall in these risk categories and know how they want to discuss it with their doctor. Women that are considered high risk are those that should get an MRI. And that's those that have a breast cancer, have a lifetime risk of breast cancer at 25% or greater, according to risk assessment tools, have a known gene mutation, and have a first-degree relative with a known gene mutation, and have had chest radiation prior to the age of 30. And so those individuals would be screened on a more frequent level, more frequent time frame based upon conversations with their providers. The U.S. Preventative Services Task Force recommends that women aged 40 to 74 are recommended to have a biannual, that's every 2-year screening, and women 75 years or older should have there's inconclusive evidence that these women should have a regular annual screening mammogram. And just for context, the Illinois Breast and Cervical Cancer Program uses the U.S. Preventive Services Task Force recommendations for breast cancer screening. We recommend in our program that you have a risk assessment, and then depending on your risk assessment, then you would go into that high risk category if you're determined to have to be high risk, and then you would get a breast MRI on an annual basis, starting at the age of 30. So we default to those high risk requirements if you are deemed to be high risk in our program.
I see. So actually that's an MRI, which is more intensive screening than a simple mammogram. Yes. I understand. All right. Now, many of us take these sorts of routine health screenings for granted. Our doctor recommends it, we go get the test. But there are people who may not have a regular provider, may not have insurance, and for them it's anything but routine. Of course, one of the ways IDPH tries to deal with that is through, as you mentioned, the Illinois Breast and Cervical Cancer Program. What is that, and what does it do?
The Illinois Breast and Cervical Cancer Program provides breast and cervical cancer screening and diagnostic services for uninsured or underinsured Illinoisans, regardless of their income. It's a federally funded program that we do in cooperation with the Centers for Disease Control and Prevention. We've been participating in this program since 1995 and have a group of local agencies that help us with identifying women who are eligible for the services and routing them through to providers for care. The screening services for breast cancer start at age 40 and include a clinical breast exam, if needed, a mammogram, MRIs, and ultrasounds. Diagnostic mammograms are also provided, as well as fine needle aspiration, breast biopsy, surgical consults. We case manage for abnormal screening results and refer to treatment through Medicaid enrollment for eligible individuals. The Breast Cervical Cancer Program also serves younger symptomatic men and women in our program to make sure that they receive services as needed.
And obviously, anybody who gets a diagnosis like this could easily be overwhelmed by all the questions that'll come up, all the decisions that'll have to be made. Are there easily accessible resources to help people understand the range of services and options available to them?
Well, as I mentioned before, the American Cancer Society has a great web presence that has information on all ranges of cancers, and breast cancer specifically, to give you guidance on how to respond and think through your needs. Once you've had a diagnosis, the Komen Breast Cancer Foundation is another resource. The National Health Institute and the Centers for Disease Control and Prevention all have great resources. The IDPH publishes the Your Right to Know booklet on this website, and which provides insight on what to do when you're newly diagnosed, gives you questions to ask, gives you tips on who to bring with you to your appointments, tips on different screening modalities and different treatment modalities, and then also kind of walks you and then provides some resources to these organizations, some website links at the end. And so that's available on the IDPH website.
Important information during this Breast Cancer Awareness Month. Phallisha Curtis, Chief of Women's Health Services for the Illinois Department of Public Health, joining us here on This Is Public Health. Joining us now on This Is Public Health with the Illinois Department of Public Health, we're speaking with Halie, who learned about some of the programs and services IDPH offers when her mom began to show symptoms consistent with breast cancer. Sadly, Halie's mom passed away from the disease, but before her death, she was able to receive assistance and services through the Illinois Breast and Cervical Cancer Program. Halie, thank you for joining us and for sharing your story. We appreciate you being here. First, let me offer our condolences on your mom's passing. Please, if you would, tell us a bit about her and what she was like.
Thank you. My mom was a very caring person. She was a caregiver and she was a giver. She loved just putting others first, and she loved being outdoors. She was very passionate about her garden and her plants and just spending time with her family and her grandchildren. And she just was funny. She was very goofy. She always liked to make people laugh, and she would always do funny dances or just make jokes just to lighten things. She had a very positive outlook on life overall.
Well, she sounds just wonderful. I know that you turned to the Illinois Breast and Cervical Cancer Program because your mom began to exhibit some health issues. So what was going on that led you to seek assistance?
My mom had been sick for a little while, but she wasn't quite sure what was going on. And we went into the ER together, and she found out that she had late-stage breast cancer that had spread to her liver, her pelvic, her bone. And she didn't have insurance. And I know that was a worry for her as far as treatment, because the cost of, cancer treatment is so expensive. And so she didn't really know what to do. I know she was worried about that. And so I took it upon myself to do some research to see what I could do for her. And I just did kind of like a web research and found the Breast and Cervical Cancer Program. And we went from there as far as the next steps. She qualified for everything. She was within the age that they had listed. She didn't have insurance, and she already kind of had the diagnosis of breast cancer from the ER. So we continued to go with them, and it was a very quick process. There was a woman there named Emily who helped me with everything, and she was really, really great of just getting the ball moving to get her biopsy and everything.
Can you talk a little bit more about some of the services that your mom and also that you as her caregiver received through the program?
Yeah, so they had basically we had to do was fill out a form, and they had covered her first appointment with her primary doctor, and then they covered everything after that. So after her biopsy, they submitted everything into the state, and she was able to get approved for insurance through their program. And so she was in the hospital up until her death. And so she was like a patient in the hospital, and they covered everything from, her treatments, just the managing the pain, and her whole entire stay there. And then they have also reached out to me multiple times since my mom passed of grief group supports. There was questions I had about there was a program that offered financial compensation for funeral expenses, and everybody that I spoke to, just whatever I needed, they were there. They helped me with any questions I had regarding the insurance or what was covered, and it really lifted a huge burden off of us.
That's so important. It's such a difficult time, and I know this is not easy for you and for your family, but to have some of those things taken care of had to give you some real peace of mind.
Yes, and it definitely did for my mom too. She didn't want anybody to be stuck with any bills, or she didn't want to get treatment if that meant there was going to be a huge financial problem. And honestly, I couldn't even get her into any cancer centers without her having insurance or making a large deposit down of like I think the one cancer center in Chicago was 10 grand up front for her to be seen. So it was just a lifesaver in this, situation.
Her story also, of course, points out the importance of early diagnosis. What's your message to people who are listening today about that?
I know it's scary, going in and trying to get checked, but I would just say, really listen to your body, advocate for yourself, and it is very important to have your regular yearly checkups or your PAPs and your breast exams and your mammograms, because they can detect breast cancer at stage 0. And, the quicker they can find something, the better the prognosis of things and your life expectancy and everything like that. And I can't stress it enough to family and friends, especially after my mom passed. And, some people can be stubborn and they don't want to go to the doctor, but it is very important to get checked.
Halie, thank you for joining us and for honoring your mom's legacy by sharing her story with us. Don't forget, if you need to know more about the Illinois Breast and Cervical Cancer Program, you can learn about it at dph.illinois.gov. Thanks, everyone, for being here. Join us next time for another edition of This is Public Health with the Illinois Department of Public Health.